Drummond.
Thank you, Madam Deputy Speaker. And as others have said this afternoon, all through this crisis, staff throughout the health and care system, whether they're NHS staff or working in the private sector, have made huge efforts and sacrifices to look after people who need their help. So I welcome this debate, this opportunity for this debate, which gives us the opportunity to pay tribute to them and to honour those who've given their lives while fighting to save others. A huge number of people in Meon Valley have contributed to the response to COVID-19, working in our hospitals and care homes, or by providing support to neighbours and relatives alongside other key workers. Now, the motion mentions that at least 312 people working across the NHS and social care have died during this outbreak. But I think it's important that we get another analysis, like the one that the Office of National Statistics released in May, which covers England and Wales. I realise that there have been different approaches across the devolved governments about collecting this data. So therefore, I hope my honourable friend will press them to help produce similar definitive data so that we can make informed judgments about the effectiveness of measures through time and also the risks for minority communities working in the NHS and care homes. Every death caused by this illness is a tragedy for a family and someone's friend and colleague, and I feel their loss. I want to touch on the point in the motion which talks about preparedness for the coming winter, when we may need to protect our NHS again, and that means protecting those who work for it. We do need to establish and maintain routine testing for staff in all areas of healthcare, which I hope will be a simpler process if the trial underway in Southampton based on saliva samples gives positive results. There is a risk, though, that although the burden of COVID is easing, we will see a surge in demand for health services unrelated to it, as diagnosis of other conditions has been suppressed during the outbreak. And I know that GPs and hospitals are anxious to get back to normal and have been contacting patients. Already the figures show an average of a 33% reduction in the emergency departments at my 3 local hospitals in Winchester, Southampton and Portsmouth. So people need to know that the NHS is open for business. And it's vital that staff get an opportunity to recover. Most have been working non-stop since January and they need a break. And if we do see a second wave during the next winter, we must be ready to deal with it effectively and properly from the outset. The last few months have been deeply traumatic for health and care staff, and I urge the government to ensure that all those staff that need it get mental health support. So I do welcome the round-the-clock mental health support line, but I hope that every care setting has procedures in place to help colleagues. Alongside that, we know that the period of confinement has been very difficult for the many people with mental health needs, and this is the time to prove that when we talk about parity of esteem for mental health, it actually gets parity. And lastly, can I pay tribute to my Right Honourable friend, the Health Secretary and his department, who, like all key workers, have not stopped and have been quick to respond to events and to us as MPs. This has been an unprecedented coronavirus for this country. We have put in many measures in place very quickly. So I thank everyone that's been part of that on behalf of the constituents of the Meon Valley, and I'm confident that we are much better prepared for the future.